Hey, this is Brian and welcome to a free video on relieving low back pain and sciatica. Today I'm going to show you a 3-level stretch progression for the hips. And the reason we're doing a stretch for the hips is because very often with low back pain, people get a lot of tightness in their hips and immobility. So that immobility leads to muscle tightness in the lower back and puts extra strain on your lumbar spine and the discs and nerves, causing your symptoms. Now, as with any exercise, I want to warn you that you shouldn't try to push through pain or do anything that's going to increase your symptoms or make your pain worse. If it does make your pain worse, you need to contact us right away. There might be just a simple adjustment we can make, or we might have to examine you a little further to see if there's something else going on. But with that, let's get started. Okay, this is level 1 of our 3-stage progression for the hip stretch. I have Vivian here to help me out today. And what you're going to do is just rest your leg on, you can use a bench or your bed or even your couch at home. And you're going to rest your leg in this position. Be careful if you feel any knee pain, you can just prop your knee up a little bit more. This is sort of a modification of a yoga pose known as the pigeon. And what you're going to do is just going to stretch out your hips and your lower back. And Vivian's going to lean forward at her spine. She's going to take some good deep breaths, maybe 3 to 5 deep breaths. And you're going to feel stretch kind of in the back of your lower back here and in your hip on the side with the knee, with the leg up. And you're going to hold that again, 3 to 5 breaths. You feel okay doing that, Vivian? Yeah. Okay, good. And then come back up. And you're going to do these exercises twice a day, every day, and you should be feeling better with that. Okay, so this is the second part of the stretch that I'm going to show you. And what I'm going to have Vivian do is she's going to take her right leg and cross it over her left. And then just like before, she's going to lean forward kind of at her hips. And she should be feeling a stretch in her lower back area and in the hip on this side. You feeling that?
Yep.
Yeah, okay. What I want you to do is just hold that for about 3 to 5 deep breaths and then come back up. And you'll do that 2 to 3 times on each leg. Now, if that's too much for you, you can come back a little bit. You can also just pull your leg up, keep your leg crossed, and just pull your knee up. You can pull your knee up this way, and you'll get a similar stretch coming down through the side of your leg there. And again, you're going to do all these stretches that I'm showing you twice a day, every day, okay? Okay, now we have the final stage progression of this hip stretch. This one's the more advanced of the 3. What I'm going to have Vivian do is lay flat on the mat with her knees bent. And she's going to take her left leg and cross it up onto the right. And then you're going to extend your arms out as far as you can, like you're reaching towards the wall. So more this way. And then what you want to do is just drop your leg over to the side. And you should be feeling a pretty good stretch in your hip and then in your lower back when you're doing this. Again, it shouldn't be causing any increase in pain and increase in symptoms. If it does, just back off a little bit. Do it about 3 to 5 good deep breaths and repeat that 2 to 3 times. And then you can switch legs and do the other side. Okay. Drop over. Again, feel the stretch there, good deep breaths. 3 to 5 deep breaths on each side, and then relax. Come back up. Okay, so that was your 3-step hip progression stretch for low back pain and sciatica. Just to recap, you want to do those stretches every day, twice a day. Hold each stretch for about 30 seconds or maybe 5 to 10 deep breaths, whichever you prefer. If you have any problems or issues like increased pain or increased symptoms, remember you need to contact us right away. If you feel you need to have a little more looked at as far as your symptoms, you can also call us and schedule an appointment. We'd be happy to look at you and take a better look at your symptoms and see what we can do for you. Thank you, and I hope to see you again.